Hello, dear students. Welcome you all to Master Nursing classes. So, myself, Mr. Nagraj, working as Nursing Officer at AIMS and your NORCET mentor and guide. So, in the last previous class, we have discussed the very important types of the stroke and what we call that is an cerebrovascular accident, also called as the brain attack. So, I explained the definition of the stroke, cerebrovascular attack, and what we call the brain attack. Okay. So, in that class, we have discussed all the terminologies, important terminologies. So, what is ataxia? What is aphrexia? What is the aphasia? So, and half body neglect syndrome, homonymous hemianopsia, and all we have discussed in detail. In this particular today's class, I am discussing the very important, that is the management of the stroke. In this video, I am discussing the what is the acute management of the stroke, what all are our strategies and the priorities in the taking care of the patient with acute patient in the acute phase of the stroke. And then this after the acute phase we will discuss the nursing managements and the medical management, what all are the medications used to prevent the stroke when the transient ischemic injury occurs. And after that we will discuss the very important one, that is related to the yes, our medical management of the stroke. That is the drugs. What all are the antiplatelets? What is the thrombolytics? And how you will use, when you will use the thrombolytics. And after that, we will see the what all are the indications, contraindications in the management of the stroke with thrombolytics. Very importantly, we will discuss each and every part in this class. So please do watch the video till the end. So if you are watching this video till the end means definitely I will assure you minimum two questions will come this one particular video. Please keep remember in mind and do watch the video completely. Okay. So here is the first one, to prevent the stroke. See, I have told in the last class what is the warning sign of the stroke. That is our transient ischemic injury. So also called as the transient ischemic attack. So when this attack occurs due to the reversible causes for short duration, so we need to alert. Okay, this is what we call our warning sign. So if the stroke occurs means that is very difficult. So in order to prevent the stroke, when the warning sign will come means at that point only we will take the yes the precautionary measures to prevent from the stroke. Okay, so to prevent the stroke, that is the manage the transient ischemic attack properly. What is the transient ischemic attack? I have explained also. So here also I will explain what is the transient ischemic attack. Transient ischemic attack is then yes the focal neurological deficit for short duration. Okay, for the short duration due to the yes the reversible causes. Very important two words you have to remember in your mind. That is the reversible causes. Okay, very important. So, how we will manage the transient ischemic attack? Whenever the transient ischemic attack occurs, so we will see the sign symptoms as in fast. So, these are the sign symptoms. There is the facial weakness, the arm weakness, the speech abnormalities, and time to ship the patient to the yes to hospital. Okay, whenever these sign symptoms occurs, so just start the medications as early as possible. That's the yes your aspirin plus clopidogrel. Very important. What is the dose of aspirin? 75 mg tablets. 4 tablets we will give together. That is the yes very important one. 300 mg. And clopidogrel. This is also coming 75 mg tablets. Here also we will give the 4 tablets together. That is also 300 mg. Oral stat. Whenever the symptoms will come, that indicates your transient ischemic attack, just give start dose of the aspirin 75 mg, that is the 4 tablets together 300 mg, and clopidogrel 75 mg, 4 tablets together 300 mg. Very important one you have to keep in your mind. So to prevent the stroke, just manage the transient ischemic attack properly. That's by managing with two drugs, that is the aspirin and clopidogrel. Very important one. So along with this, we will give the yes the lipid lowering agent, that is the atorvastatin. Okay. So one more lipid lowering agent will give, because when you will give the lipid lowering agent here, That is our statins. In this, we will give the atorvastatin. Okay, very important drug. By giving this drug, which decreases the low density lipoprotein, or what we call our bad cholesterol. So it decreases the bad cholesterol. So cholesterol is decreasing means there is no more formation of the thrombosis. Okay, there is risk of the formation of thrombosis is there. So if you are giving the, we are lowering the or bad cholesterol means no more risk for formation of the thrombosis. So very important one. Because of that, we will give the atorvastatins. That is the statins. We are reducing the bad cholesterol. What is the normal cholesterol level? Yes, very important. Less than 200 mg per deciliter. So the cholesterol level should be in our blood is should be less than 200 mg per deciliter. Very important. Okay. Please note in your notebook. Yes. So this is how we will manage the our transient ischemic attack. So to prevent the stroke. Okay. So when the stroke occurs, we will see what all are the acute management. When the patient with strokes comes to the hospital, so how you will manage suddenly. Okay. So that is the what we call the acute phase of the management of the stroke. When the patient is in the acute phase, we will manage the pulse, we will manage the airway. Okay, we will establish the airway, we will see the patient condition and we will establish the airway, we will open the airway and we will administer the yes oxygen and we will do the suctioning. But nasal suctioning is contraindicated because when the patient with the hemorrhagic strokes comes means when we will doing the nasal suctioning, which increases the intracranial pressure. So nasal suctioning is contraindicated. If there is any oral suction, any secretions that is interrupting your airway means at that point of the time we will only do the suction. That is only yes the less than 10 second. Very important one. So it should be less than 10 second. And if there is when we assess the Glasgow Coma scale, the GCS value goes less than 8 means we will shift the patient to the mechanical ventilator or non-invasive ventilator NIV. Okay, we will shift the patient to NIV. Okay, very important. So after that we will establish the breathing. How we will establish the breathing? We will give the proper positioning to expand the chest. That is the head of the bed. Elevate. We will elevate. Yes, more than 30 degree. Along with that, we will give the side lining position to the patient. Okay, so that if there is any secretions will come, is that will comes out. Okay, so and we will maintain the circulation properly by maintaining the blood pressure in acute phase. That is the more than or equal to. Okay, more than or equal to 150 by 100. Because if the blood pressure goes less than this means the cerebral blood supply will decreases because already there is a deficit in the stroke. So if the blood pressure is going less than this means it's very important to maintain the blood pressure to 150 by 100 in order to maintain the cerebral perfusion pressure. Okay, cerebral perfusion pressure, very important one. So and we will monitor the intracranial pressure for the first 72 hours or the 3 days. Okay, first 3 days we will monitor the ICP very carefully to the patient with the stroke. Okay, so here in the management of the stroke, so there is different types of the management because there is always different types of the strokes also there. So how we will manage the particular strokes, we will see here. So first we will diagnose the stroke. When the patient comes to the hospital in the acute phase, we will try to diagnose as early as possible whether it is an ischemic stroke or else it is an hemorrhagic stroke, because the entire treatment is changes. If it is an ischemic stroke means the treatment is very different, and if it is hemorrhagic stroke means the treatment is very much different. The treatment of the hemorrhagic stroke is contraindicated in ischemic stroke, and the treatment of the ischemic stroke is contraindicated in the hemorrhagic stroke. Very importantly, so because of that, so what if the we are giving the hemorrhagic stroke treatment in ischemic stroke means the patient will die. If in case we give the ischemic stroke treatment in the hemorrhagic stroke means the patient will die. So because of that, in order to prevent the mismatch of the treatment as early as possible, we will diagnose the patient whether it is an ischemic stroke or whether it is an yes the hemorrhagic stroke. How we will diagnose this one? So by doing the cerebral angiography and by doing the CT of the or MRI of the brain, very important one. So if we diagnose the patient as an ischemic stroke, we have discussed the thrombotic and embolic stroke. So where the brain is there and the blood supply to the brain is interrupted due to the yes formation of the thrombus or accumulation of the emboli in the cerebral blood vessels. So decreased blood supply to the brain leads to the stroke. So this is what we call the ischemic stroke. So in the ischemic stroke, where we will damage this thrombus. So we will use the thrombolytics. Okay. So and we need to dissolve this one also. We will use the thrombolytics. And in order to prevent the further accumulation of the platelet here and further formation of the thrombus we are preventing means we will give the antiplatelets. Okay, we will discuss in detail in next slides. Okay, so in the hemorrhagic stroke, hemorrhagic stroke itself indicates the stroke is occurring due to the hemorrhage, so we will stop the bleeding there. Okay, and we will prevent the seizure and we will monitor for the increased intracranial pressure and we will prevent the agitations in the patient. I am discussing those points: how we will stop the bleeding, how we will prevent the seizure, how we will manage the intracranial pressure, and what are the drugs which are given to prevent from the agitations. I am discussing each and part every point in detail because that is very important for your exam purpose. So please do watch. Okay. So let me start with the ischemic stroke management. Okay. So how we will manage the patient in the ischemic stroke means the medical management of the patient with the ischemic stroke. Okay. We'll discuss separately. Okay. Very important one. So that is the medical management of the patient with the ischemic stroke. What happening in the ischemic stroke? In the ischemic stroke, inside the blood vessel, there is formation of the thrombus is there. Okay, and there is accumulation of the emboli. There is elsewhere the clot that came from the elsewhere of the body. Okay, that is the emboli. We need to destroy this emboli. We need to dissolve this thrombus. So we uses the thrombolytics. Along means what is the thrombolytics? Thrombolytics are the thrombus plus lytics means where lytics means the dissolving, the destroying. Okay, that is what we call the lytics. So we will use the thrombolytics also. Before using the thrombolytics, we use just the antiplatelet. Why? Because the clot, the thrombus that occurs due to the formation of the clot. So in order to prevent the further increasing in the clot formation, so we use just the antiplatelet first. Okay, the first medicines that should be given in the acute phase of the stroke is in the ischemic stroke is the antiplatelet medications, which prevents the further clot formation. So further clot formation preventing means further blocking of the blood vessels preventing. So after that, if in case the patient comes to the hospital within 4.5 hours means we will use we will use the thrombolytic medications, we will use the thrombolytic therapy. Okay, so here let me discuss on the antiplatelet medicines. So we are having the two important antiplatelet drugs, that is the aspirin and clopidogrel. So we will give that one first. Okay, so very important one, we have to monitor for the patient for the metabolic acidosis when the patient is in the aspirin, because the high dose of the aspirin we are giving here as in 75 mg 4 tablets 300 mg we are giving. And as the aspirin is acid, okay, what is the chemical name of the aspirin? That is the acetyl salicylic acid. What is the chemical name of the aspirin? That is the acetyl salicylic acid. So we are giving the acid. So pH is decreasing and the H plus ions are increasing, means there is highest chance of formation of the metabolic acidosis. So we will monitor the ABC values when the patient is in the highest dose of the aspirin in order to assess the metabolic acidosis. And why we are giving the antiplatelet medications? Very importantly, examiners ask in the exam the purpose of antiplatelet medications in ischemic stroke. That is to not to destroy the clot. We are destroying the clot with the thrombolytics. Why we are giving means to prevent the further formation of the clot. Okay, so more clot formation ಆಗಬಾರ್ದು ಅಂತ ಹೇಳಿ ನಾವು aspirin and the clopidogrel antiplatelet medication ಕೊಡ್ತಿದೀವಿ. So very importantly, okay, that's the purpose. So if in case the patient comes in the within 4.5 hours means ನಾಲ್ಕೂವರೆ ಗಂಟೆ ಒಳಗಡೆನೆ ಪೇಷಂಟ್ ಹಾಸ್ಪಿಟಲ್ ಬಂದ್ರೆ ಸ್ಟಾರ್ಟ್ ಮಾಡ್ತೀವಿ ಥ್ರೋಂಬೋಲೈಟಿಕ್ ಥೆರಪಿ. ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್ ಒನ್. ಓಕೆ, so let me discuss the thrombolytic therapy. Very important. What is the thrombolytics? Thrombo means the, yes, the clot. Okay, what is the, that is the thrombus means the clot. Okay, so lytics means the break. Okay, we are using those medications to break the clot or the thrombus. Why? Because the stroke, that is in the ischemic stroke, occurred due to the formation of the clot, thrombus. So we will destroy this thrombus, so the blood supply to the brain is very much clear. Then the further damage to the brain cells will decreases. So that is what we will using the thrombolytics to destroy this thrombus. Okay, very important. So we are having the drugs in the thrombolytics as an altiplase, as the retiplase, streptokinase, urokinase. What will these drugs will do? These drugs will activate the recombinant tissue plasminogen activator. So tissue plasminogen activator, these drugs activates. So where in the liver the plasminogen converts into the plasmin, so the plasmin destroys the clot. Let me explain the mechanism of action of the, yes, the thrombolytic agents. See, this is your beautiful blood vessel. Where there is any damage to this particular vessel, the bleeding will occur. After bleeding, there is an hemostasis. After the hemostasis, the clot will get formation like this. Okay, so after the, yes, 72 to 96 hours from the liver, we are having one enzyme in the liver, that is in plasminogen. Okay, so this plasminogen, the factors which are released from this clot converts this plasminogen to plasmin. Plasmin is the active form of the plasminogen. This plasmin is the very important component that is responsible for destroying the this particular clot. Okay, so what are the medications we are giving here? The altiplase, the retiplase, the streptokinase, the urokinase. These medications activates this plasminogen to plasmin. So very important by recombinant tissue plasminogen activators. That is the TPAs medications also we call. So this tissue plasminogen activated means this plasmin, this converts the plasminogen to plasmin. This plasmin is an active form of the plasminogen that destroys this particular clot. So if destroying this particular clot means that destroying this particular thrombosis means, so we call that is an thrombolytics. Okay, very important one you have to keep in your mind. This is how our thrombolytics will work. Okay, so what is the use of the thrombolytics? So thrombolytics use when the patient with the strokes comes within the 4.5 hours to the hospital. Okay, very important. ಎಕ್ಸಾಮ್ನಲ್ಲಿ ಕ್ವಶನ್ ಕೇಳ್ತಾನೆ ಯಾವಾಗ ಥ್ರೋಂಬೋಲಿಟಿಕ್ಸ್ ಯೂಸ್ ಮಾಡ್ಬೇಕಂತ. ಸ್ಟ್ರೋಕ್ ಪೇಷಂಟ್ ವಿತಿನ್ 4.5 hours ಒಳಗಡೆನೆ ಹಾಸ್ಪಿಟಲ್ಗೆ ಬಂದ್ರೆ we will use the thrombolytics. Otherwise, we will not use these medications. If in case the myocardial infarction patient with ST elevation in the ECG, ST elevated MI patient comes within 12 hours means we will use the thrombolytics. Otherwise, we will not use the thrombolytics. And the massive pulmonary embolism is there means the emboli, the clot, that is free flowing clot that accumulated in any major blood vessels of the pulmonary system means that is what we call the massive pulmonary embolism. At that point also we use the thrombolytics. Otherwise usually we will not use the thrombolytics. But and we are having the very important, so very important one you have to note in your notebook, that is the contraindication of the thrombolytics. We will never ever use the thrombolytics in the patient with the hemorrhagic stroke, because the stroke is occurring due to the bleeding, the hemorrhage. So already there is bleeding, we are using the medicine that is promotes the bleeding means the patient will die. So if that, because of that, we will never ever use the thrombolytics in the hemorrhagic stroke. We will use the thrombolytics in the only ischemic stroke. Okay, and when the patient comes with the myocardial infarction without ST wave elevation, So in a non-ST elevated MI, we will never ever use the thrombolytic medication. Okay. If the patient having any recent big surgeries, and if the patient having any recent head injuries, means we will never ever use the thrombolytics, because which promotes the internal bleeding. If the internal bleeding occurs, means there is a highest risk of the mortality. So we will never ever use the thrombolytics in patient with the recent big surgeries and recent head injury history. Okay. And if the patient is suffering from any bleeding disorders, so at that point also we will never use the thrombolytics. The very important contraindications you have to know: in hemorrhagic stroke, we will not use; in non-ST limited MI, we will not use; in recent big surgeries and as the head injury, we will not use; and patient with the bleeding disorders, we will not use. Very important. Okay. Yes. So let me discuss on the anticoagulants. Okay, that is the very important one we have to use in the stroke, because this in the only in the ischemic stroke. Okay, this is to manage the patient with the stroke. Okay, so not to any uh, treatment like to destroy the clot. This is to prevent the further accumulation of the clot like the antiplatelet. But in acute phase, we will use the antiplatelet, not anticoagulants. Okay. So anticoagulants are the medications which are used to decrease the as the coagulation. So the clotting factors will be decreased here. So because of that, there is no any coagulation. So there is no any coagulation means there is no any clot formation. There is no any clot formation means there is no any thrombus formation. There is no any thrombus formation means yes, the no any ischemic stroke. So in the ischemic stroke, we will use the anticoagulants also in the lifetime management of the patient with the ischemic stroke. Okay. So we are having the heparin and warfarin. So very important two drugs we are having the in the anticoagulants, heparin and warfarin. Okay. So heparin is the we are having the brand name of in the name of the enoxaparin, and warfarin we are having the brand name of the Coumadin. Very important, because in many exams many examiners ask for the brand names also. Enoxaparin is nothing but the heparin, and Coumadin is nothing but the warfarin. Okay, both are same. So heparin and enoxaparin is same. Warfarin and Coumadin is the same. Okay, very important. So when we use the heparin and warfarin, it's very important to monitor the therapeutic range of these drugs, because there is very short therapeutic index. If the medication is little bit more means it will just cause the toxicity, and little bit less means it will won't work. So because of that, so these medications having very short therapeutic index, so we should monitor the therapeutic monitoring of this patient, because the overdose may leads to the uncontrolled internal and external bleedings that is very harmful and which may having the highest mortality rate. Because of that, we should monitor the patient with the heparin and warfarin for the yes the toxicity, and therapeutic monitoring is the very important. Okay, when we having the patient, if he is having the any heparin tablet or injection, that is enoxaparin, we should monitor the patient for the yes the APTT values. Okay, the normal APTT is in normal person is the 30 to 40 second. So when the patient taking the heparin, the normal APTT value with patient with as the heparin is the 60 to 90 second. Very importantly, 2 to 3 times increases here. Okay, what is the 2 to 3 times? Yes, the APTT values increases in the patient with the heparin, that is the normal. If it is increasing more than this means there is risk of the bleeding. So examiner ನಿಮಗೆ ಕ್ವಶನ್ ಈ ತರ ಕೇಳ್ತಾನೆ, ಪೇಷಂಟ್ ಹೆಪರಿನ್ ಮೇಲಿದೆ, ಅವನದು APTT ವ್ಯಾಲ್ಯೂ 70 ಇದೆ. ಸೊ ಅವಾಗ ನೀವು ಏನ್ ಇಂಟರ್ವೆನ್ಷನ್ ಮಾಡ್ತೀರಾ? ವೆದರ್ ಯು ವಿಲ್ ಇನ್ಫಾರ್ಮ್ ಟು ಡಾಕ್ಟರ್, ವೆದರ್ ಯು ವಿಲ್ withhold the drug, whether you will inform to doctor and withhold the drug, and all the above. Okay, ಈ ರೀತಿ ಕ್ವಶನ್ ಕೇಳಿದಾಗ ಸೊ ಆಪ್ಷನ್ ಡಿ ಏನಂದ್ರೆ ಇಟ್ಸ್ ಎ ನಾರ್ಮಲ್, ಆಪ್ಷನ್ ಡಿ ಇಸ್ ದ ನಾರ್ಮಲ್. ಸೊ ಅವಾಗ ನೀವು ಆನ್ಸರ್ ಇಟ್ಸ್ ಎ ನಾರ್ಮಲ್ ಅಂತ ಹಾಕ್ಬೇಕಾಗುತ್ತೆ. ವೈ? ಬಿಕಾಸ್ ಸೊ ನಿಮ್ಗೆ ಹೆಪರಿನ್ ತಗೊಳ್ಳೋಂತ ಪೇಷಂಟ್ಗೆ APTT ವ್ಯಾಲ್ಯೂ ಎಷ್ಟಿರುತ್ತೆ ಅಂದ್ರೆ 60 to 90 ಸೆಕೆಂಡ್ ಇರುತ್ತೆ. ಸೊ we are having the APTT value as in 70, that comes in the normal category. Okay, very important. If it's going behind the 90 means we will inform to the doctor and withhold the drug. Very important one. Similarly in warfarin, we assess as the PT-INR value. The normal PT-INR is the 0.6 to 1.2. In patient who is taking the warfarin, his normal PT-INR value is the 2 to 3. If the value is more than 3 means there is the highest risk of the bleeding. At that point of the time, we will inform to the doctor. So if the value between the 2 to 3 means the patient with warfarin, he is taking the warfarin. So when we assess the PTNR, his value is between the 2 to 3 means that is the normal therapeutic value. No need to worry. Okay, very important one we have to keep in our mind. So that is the how we will manage the as the ischemic stroke. Let me discuss on the treatment of the hemorrhagic stroke. So hemorrhagic stroke ಅಲ್ಲಿ ನಮ್ದು ಮೋಸ್ಟ್ ಕಾಮನ್ ಕಾಸ್ ಆಫ್ hemorrhagic stroke ಏನಿದೆ ಎಸ್ ದ ಅನ್ಕಂಟ್ರೋಲ್ಡ್ ಅನ್ಟ್ರೀಟೆಡ್ ಕ್ರೋನಿಕ್ ಹೈಪರ್ ಟೆನ್ಷನ್. ಸೊ ಹೈಪರ್ ಟೆನ್ಷನ್ ಆಗ್ಬಿಟ್ಟು ಸೆರೆಬ್ರಲ್ ಬ್ಲಡ್ ವೆಸಲ್ಸ್ ರಪ್ಚರ್ ಆಗ್ಬಿಟ್ಟು ಸೊ ಬ್ರೈನಿಗೆ ಬ್ಲಡ್ ಸಪ್ಲೈ ಹೋಗಲ್ಲ. ಸೊ ಬ್ರೈನಿಗೆ ಬ್ಲಡ್ ಸಪ್ಲೈ ಹೋಗ್ಲಿಲ್ಲ ಅಂದ್ರೆ ಸ್ಟ್ರೋಕ್ ಆಗುತ್ತೆ. ಓಕೆ, ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್. ಸೊ ಅವಾಗ ಏನಾಗುತ್ತೆ, ಇಲ್ಲಿಂದ ಬ್ಲೀಡ್ ಆಗ್ತಿರುತ್ತೆ, ಕಂಟಿನ್ಯೂಸ್ ಬ್ಲೀಡಿಂಗ್ ಆಗ್ತಿರುತ್ತೆ ಇನ್ಸೈಡ್ ದ ಬ್ರೈನ್. So to stop the bleeding, we need to activate the clotting factor. We need to activate the clotting factor means we need to give the vitamin K. Vitamin K injection ಕೊಡ್ತೀವಿ, which increases the coagulation by increasing the clotting factor. So what examiner ನಿಮ್ಗೆ ಕೇಳ್ತಾನೆ, which all are the clotting factor which are dependent on the vitamin K. So vitamin K dependent clotting factors are 2, 7, 9, 10. Very important. 2, 7, 9, 10. The clotting factor number 2, 7, 9, 10. These all are the clotting factor which all are dependent on the vitamin K. So lack of vitamin K leads to the decreased activation of the 2, 7, 9, 10, which increases the bleeding. If you are giving the injection vitamin K, so which activates the clotting factor 2, 7, 9, 10. So if it is activating the clotting factor 2, 7, 9, 10 means, yes, the very importantly, the blood coagulation increases. The coagulation increases means the bleeding stops. Very important. And we maintain the blood pressure. So to decrease the blood pressure to if it is 200 by 100 like this means we will decrease this to yes, so 150 by 100. So in acute phase followed by acute phase. In the chronic management we will keep the BP less than 140 by 90. Why? Because why we need to maintain the 150 by 100 in the acute phase means, ಸೊ ನಾವು ಅಲ್ಲಿ ಬ್ಲಡ್ ಪ್ರೆಷರ್ ಕಮ್ಮಿ ಮಾಡಿದ್ರೆ ಸೆರೆಬ್ರಲ್ ಬ್ಲಡ್ ಸಪ್ಲೈ ಕಮ್ಮಿ ಆಗುತ್ತೆ. ಸೆರೆಬ್ರಲ್ ಬ್ಲಡ್ ಸಪ್ಲೈ ಕಮ್ಮಿ ಆಗಿದ್ದ ಕಡೆಯಿಂದ ಸ್ಟ್ರೋಕ್ ಆಗ್ತಿದೆ. ಸೊ ಮತ್ತೆ ನಾವು ಬ್ಲಡ್ ಸಪ್ಲೈ ಕಮ್ಮಿ ಮಾಡಿದ್ರೆ if we decreases the further blood supply to the brain, so there is highest risk of more damage of the brain. So in order to prevent that one, we need to maintain the BP in acute phase as in 100 by 150, sorry 150 by 100. So in order to maintain the normal cerebral perfusion pressure. Okay, cerebral perfusion pressure na proper ಆಗಿ ಮ್ಯಾನೇಜ್ ಮಾಡಕ್ಕೆ. So in acute phase of the stroke ಅಲ್ಲಿ we maintain the blood pressure by as in 150 by 100. Okay, then in the following the acute phase we will keep the BP less than 150 by 90, 140 by 90. So by giving the antihypertensive of the choice here is the captopril and enalapril. These are the AC inhibitors. Okay, AC inhibitors, angiotensin converting enzyme inhibitors drugs. That is the captopril and enalapril. So these medications will be used to decrease the BP. And if the bleeding in the brain means there is highest risk of occurrence of the seizure also. So to prevent the seizure, we use the sodium valproate in the patient with the as the stroke. That is with the hemorrhagic stroke. Okay, and if the patient is agitated much more means we will decrease the agitation of the patient by giving the sedatives. And the sedatives of choice in patient with the stroke is the carbamazepine we will give. And so this is the very important one we have to keep in our mind. So prevent the agitations, we are giving the sedatives, that is the carbamazepine. Okay, so this is how we will manage the patient with the hemorrhagic stroke. Note, very important one. All medications which are used in the ischemic stroke are contraindicated in the hemorrhagic stroke. Similarly, all medications which are used in the yes, especially the vitamin K which is we are using in the hemorrhagic stroke is contraindicated in the yes, the very important one, ischemic stroke. You have to keep in your mind. Okay, ಸೊ ಯಾವ್ಯಾವ ಮೆಡಿಕೇಶನ್ಸ್ ನಾವು ಇಸ್ಕೆಮಿಕ್ ಸ್ಟ್ರೋಕ್ ಅಲ್ಲಿ ಕೊಡ್ತಿದ್ದೀವಿ ಆ ಎಲ್ಲಾ ಮೆಡಿಕೇಶನ್ಸ್ ಹೆಮರೇಜಿಕ್ ಸ್ಟ್ರೋಕ್ ಅಲ್ಲಿ ಕಾಂಟ್ರಾಇಂಡಿಕೇಶನ್ ಇವೆ. ಓಕೆ, ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್. ಸೊ ಹಿಯರ್ ಇಟ್ ಕಮ್ಸ್ ಅವರ್ ನೆಕ್ಸ್ಟ್ ಒನ್, ದಟ್ ಇಸ್ ದ ಪೋಸ್ಟ್ ಅಕ್ಯೂಟ್ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ಆಫ್ ದಿ ಪೇಷಂಟ್ ವಿತ್ ದ ಸ್ಟ್ರೋಕ್. ಅಕ್ಯೂಟ್ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ಅಲ್ಲಿ ನಾವ್ ಏನೇನ್ ನೋಡಿದ್ವಿ, ಏರ್ವೇ ಹೆಂಗ್ ಮ್ಯಾನೇಜ್ ಮಾಡಬೇಕು, ಆಕ್ಸಿಜನ್ ಅಂಡ್ ಆಲ್ ವಿ ಹ್ಯಾವ್ ಡಿಸ್ಕಸ್, ಅಂಡ್ the breathing circulation as a priority is the airway breathing circulation comes like this. And after that we have discussed the how we will manage the patient with the the ischemic stroke, where we are using the yes, the thrombolytics anticoagulants, antiplatelets and all. And after that we have discussed the hemorrhagic stroke. So hemorrhagic stroke ಅಲ್ಲಿ ಹೇಗೆ ಬ್ಲೀಡಿಂಗ್ ಕಂಟ್ರೋಲ್ ಮಾಡಬೇಕು, ಹೇಗೆ ಸೀಜರ್ ಪ್ರಿವೆಂಟ್ ಮಾಡಬೇಕಂತ ಮೆಡಿಕೇಶನ್ಸ್ ಗಳನ್ನ ನಾವು ನೋಡಿದ್ವಿ. ಸೊ here it completes our acute phase management of the stroke. Just the very important part starts now. There is the post acute management of the stroke, because there is less role of nursing officer when caring the patient within acute management as compared to the post acute. There is major role, but as compared to the post acute management, less role. Okay, very important, you have to keep in our mind. The post acute management of the strokes comes like this. We need to maintain the each and every activities of the stroke patient, because the stroke patient is highly dependent on the nursing care, and his activities of daily living is also dependent on others. So because of that, it's very important to manage the patient of the stroke in the, yes, that is in the post acute management. So now nursing management comes like this. We need to change the position of the patient every 2 hourly. Okay, and we will keep the patient 2 hours on the unaffected side. Okay, the left side is stroke is there, means we will keep the patient right side for 2 hours, and if the left and affected side 20 minutes, and we can give the prone position also. If there is no any respiratory difficulty, means we can give the prone position also. Okay, 2 hours unaffected side we will keep, and 20 hours affected side we will keep. Very important one. Okay, so the nutritional measures are also very important, because the patient having the one side drooping of the face, and his muscle of the mastications are also weak, so he can't chew properly. We will give the soft diets, semi-solid diets here. Okay, very important one. So while giving the food, so we, if the patient having the food, means we will give the which position to the patient. That is the high polar position we should give, because the pharyngeal muscles also weak in the patient with the stroke. There is highest risk of the aspiration. So to prevent the aspiration, we will ask the patient to uh, be in sitting position, and we will give the position with high polar position, with the head and neck slightly forward, bend forward, in order to prevent the aspiration. Okay, and very importantly, we need to monitor the gag reflex and ability to swallow before giving the food. The gag reflex is not is normal, means and he is not able to swallow, means if you are giving food, means it will go into the trachea, that may leads to the aspiration, and that may leads to the aspiration pneumonitis, and the patient will die. So in order to prevent that one, we need to monitor the gag reflex and ability to swallow before giving the food in the patient with a stroke. Very important one. Okay, okay, so and place the food back of the mouth and completely inside mouth in unaffected. So if the right side weakness is there, means we'll keep the food back side of the mouth in unaffected side, so the patient can chew it normally and he can swallow it at that side only. The very important one, place the food back of the mouth, inside the mouth, in the in unaffected side. Okay, to prevent the trapping of the food in the mouth. So and very importantly, patient with stroke, we need to give the, yes, the mouth care, and all care we have to give here. Patient eye care also, because the patient is having the homonymous hemianopsy and all. So very importantly, because the patient is having the weakness, means some food will trap in the mouth only. ಬಾಯಿ ಒಳಗಡೆ ಫುಡ್ ಸ್ವಲ್ಪ ಜಾಸ್ತಿ ಟೈಮ್ ಇರೋದ್ರಿಂದ ಹ್ಯಾಲಿಟೋಸಿಸ್ ಆಗುತ್ತೆ. ಹ್ಯಾಲಿಟೋಸಿಸ್ ದ ಬ್ಯಾಡ್ ಆರ್ಡರ್ಸ್ ವಿಚ್ ಕಮ್ಸ್ ಔಟ್ ಆಫ್ ದಿ ಮೌತ್, ದಟ್ ಇಸ್ ವಾಟ್ ವಿ ಕಾಲ್ ದ ಹ್ಯಾಲಿಟೋಸಿಸ್. ಸೊ ಹ್ಯಾಲಿಟೋಸಿಸ್, ಪೇಷಂಟ್ ಹ್ಯಾಲಿಟೋಸಿಸ್ ಆದ್ರೆ ಪೇಷಂಟ್ಗೆ ಸೊ ಕಂಪ್ಲೀಟ್ ಡಿಸ್ಕಂಫರ್ಟ್ ಆಗುತ್ತೆ, ಅಂಡ್ ಕೇರ್ ಗಿವರ್ಸ್ ಆಲ್ಸೋ ಕಂಪ್ಲೀಟ್ ಡಿಸ್ಕಂಫರ್ಟ್ ಆಗುತ್ತೆ. ಟು ಪ್ರಿವೆಂಟ್ ದಟ್ ಒನ್, ಸೊ ವಿ ವಿಲ್ ಗಿವ್ ದ ಮೌತ್ ಕೇರ್ ಟು ದ ಪೇಷಂಟ್ ವಿತ್ ದ ಸ್ಟ್ರೋಕ್, ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್ಲಿ. Okay, so and intervention in the chronic phase of the stroke. So we have discussed the acute, post acute phase, and here is the chronic phase. Each and every point is very important one. I am telling you direct questions what I am telling and what I am explaining in the interventions will arises in your exam, so don't regret after. So please note the complete notes what I am given here, and yes, the do revision and solve the question from your NCLEX and PRA and target head books. Very important. Your concept will be more clear. Okay. So in the chronic phase, if the patient is having the one side complete negligence, means the she is having the left side stroke, means the complete body the patient is neglecting left side. So in the neglect syndrome, in the what happens in neglect syndrome, the paralyzed part of the body patient will completely neglect, and he will not use that body uh, for anything. So that is what we call the neglect syndrome. So with the patient with the neglect syndrome, we'll ask the patient to use the his paralyzed part, and you will ask the patient to touch and feel the paralyzed body part also, because he should know that his half of the part is still intact with his own body. Okay, very important point. And so very important instructions in the patient with the hemianopsia. What is the hemianopsia? Half side vision loss. Half side vision loss. Hemi means half. Anopsia means loss of vision. So what is the hemianopsia? Half side vision loss. At that point of the time, we will educate the patient of the parents of the patient regarding the so visual field of the patient. So how we will educate? We will tell the their own bystanders or attenders of the patients like this. Your patient half vision is got lost due to the stroke. So whatever if you want to give to the patient, please give to the intact means normal vision set. Half vision, if the left side vision lost means the right side vision is still normal. So if you want to approach, if you want to say anything, if you want to give any sharp object, blunt or anything, so please give that thing from the right side so patient can watch and hold it normally. So there is less risk of the injury. Okay, very important. And we will ask the patient to scan by, or we will ask the patient to view the surroundings by turning his head. So because of that, the patient may know the surroundings also well. And if we have the patient daily routine activities, objects, and his personal things, we should keep in the normal vision field only, where the person able to see there only will keep, so that patient it's easily accessible for the patient and the patient may get it easily. So this is what the nursing management in the chronic phase and in the acute phase, post acute phase. Very, very importantly, we have discussed each and every point in the management of the patient with the stroke. So please do subscribe to the channel if the content, if the explanation, and if the given teaching and explanation is helpful for you, please share the video to your friends and the students who are actually in the need of the content. Okay, so thanks for watching the video. Be connected with the master nursing classes. We will meet in the next class. Thanks so much.